Um, First of all, the earlier the eating disorder is detected, the better the recovery rate is. Eating disorders, anorexia usually erupts around 13 or 14. Bulimia, usually it's a little later in adolescence, more entry into college age. If we can catch individuals within the first year or so of their using those symptoms, the recovery rate is much, much better. So the longer a person has been involved in the disorder and the more frequently they've used the symptoms, the harder it is for them to recover. So in terms of what can we do for prevention, it's being much more aware and talking a lot more about this. But as far as treatment goes, if a person has not been involved in these behaviors for too long, a lot of times they can find recovery in an outpatient setting. The research is now showing us that for adolescents in treatment, it's very important that their family be in the treatment process with them. If a young woman is sent off to treatment, if she spends a month or 6 weeks in a treatment facility and she learns about the right things to eat and her meal planning, and then she comes back into a family system that doesn't support that, it makes it almost impossible for that individual to come back into the family system. But what we're finding is there are some new programs developed around the Maudsley Hospital in England. So it's now called the Maudsley approach, which rather than put an adolescent into a hospital setting, they bring the family into treatment, and the parents are really coached at how do they set up the boundaries and the guidelines around food. And there's a lot of research that's been done with that with really good results. Most inpatient facilities bring the family in for some kind of family work, which might be a week long, but I think the ideal treatment or recovery treatment would be to allow an adolescent to stay at home, to stay in their school, to continue in their activities as long as they're able while they're getting this other supportive educational treatment. When you are dealing with an adult, and we're seeing more and more adults who develop eating disorders midlife or even into their 50s or 60s, you don't have the same option with family treatment. So it's more individual treatment. Again, using a dietitian, probably having a medical doctor that's doing frequent checks on all these things we talked about before as far as their heart rate, their blood pressure, their electrolytes. Sometimes having them involved in group and hearing other individuals talk about their struggles. And if they're married or in a significant relationship, then sometimes it's helpful to bring that person in and include them in the treatment and the recovery work. Eating disorders are usually long-term treatment. It's not usually something you can say, okay, we'll do 8 weeks. You'll be on your road to, the rest of your life. It's expensive because a therapist can only provide the psychological part of the treatment. We do usually need a dietitian involved. We need visits to the medical doctor, and the frequency of that depends on the severity of the symptoms. We might need a psychiatrist with medication therapy also. And what the literature says about eating disorder recovery is it takes somewhere between 7 and 10 years. Now, the first phase is reducing the symptoms. So you may have some pretty good success in 3 months or 6 months of getting a person to stop starving themselves or to stop binging and purging. But the thoughts about food, the tendency to want to use those behaviors lingers a lot longer than the physical behavior. So once you get a person eating a healthy meal plan, that doesn't usually mean everything is fine and there's no longer a struggle. And because the eating disorder was something that they used to cope, the first time their coping system is overwhelmed, the eating disorder behavior is the first thing they're going to want to go back to. So the long-term process of recovery takes quite a bit longer than actually getting a person to stop using the behavior.